I'm Sam Goldstein. I grew up in New York City. I've been the executive director of a clinic. We see about 800 to 900 children a year with genetic disorders and brain injuries, and we're in our 45th year.
Hi, I'm Jack Naglieri. I started in school psychology actually 50 years ago and went off to the University of Georgia to get my PhD, and that changed my life. I had the opportunity to help the Kaufmans build the KABC, and after I did that, I started to make my own tests.
Jack and I had already begun speaking about particular areas of childhood development, what we call abnormal development, in which there clearly was an absence of good tools, and autism was one of them. Our clinic had been specializing in seeing children with autism, so I'd worked with a lot of children even at that point, and that's how we started. And we created a metric I learned from Jack, how many items you need versus how many items you want to end up with, and how you organize and write the items, and that's what we did. The ASRS Adult is a narrow spectrum tool. It's used when you have a question about autism or autism-related behaviors. It's a self-report and an observer report. It asks about relationships. It asks about certain patterns of behavior like repetitive or stereotypic behaviors. It asks about patterns of communication. The instrument allows you to take what is observed behavior and convert it to an interpretable statistic. We created the ASRS so it can be used to develop a treatment plan. It has treatment scales that look at socialization, that look at attention. These tools help you differentiate for the individual their patterns of strengths or weaknesses or normal functioning, which helps you better identify intervention.
We spent a lot of time studying every single question. Meticulous examination of the items and the data related to those items. We had terrific people to work with here at MHS, people who would challenge us. What about this? What about that? Should we really get rid of this? Should we really keep it? If you look at the tools that we've created, it's very clear that our emphasis has been building tools that are very strong from a psychometric standpoint. And we make it clear how to use that tool, what guidelines should be used, so that we can maximize the benefit for the adult that we're trying to help.
What we do is built on trust. The adult trusts us to provide a fair and objective evaluation. Clinicians can rely upon it, that it measures what we say it measures in a valid and reliable way. It's a tool you can count on.